I was really excited when I knew that a gallery was opening here because I've had a long involvement with art.
This building in the heart of the hospital, you just don't know who's going to come in. You know, you've got members of staff that are coming to eat their packed lunch because it's quiet. You know, you've got people that are just get bored, they're on the wards and in their dressing gowns, so they're not coming to be impressed by the art. Some of them are just coming to escape or just have a distraction.
I remember you, Mel, saying to me, would you like to submit some work for consideration for one of the exhibitions? Every time I've shown you any of my work, you've always been very encouraging, and that's given me massive confidence.
I am an accidental artist. You know, I haven't had any training. I never even had any desire to do visual arts. And I did my first ever exhibition here. And what I loved about working here was, you know, I wasn't feeling judged by my lack of education.
The Arts Council was sort of looking for people to be part of Lead Creative Schools, which is an Arts Council project. As part of that proposal, I suggested that we might be able to exhibit at the hospital. The school was very keen to do this, so we worked on a project at the school and then exhibited it at the gallery, and Melanie curated the exhibition. And then after that, Melanie actually suggested that the work should travel. It seemed like an exhibition that shouldn't just be in the hospital, it should go elsewhere. So we actually ended up having an exhibition of my work and these children's work based on the work that we'd created for Llandough Hospital, actually at the Hearth Gallery in London.
What was interesting for me is that because I have a diagnosis of bipolar, all of my work across all the art forms is kind of often related to the issue of mental health. The staff across the road at the mental health unit, they saw the value in it in terms of approaching and addressing mental health and breaking down the barriers between staff and patient.
I actually became ill a few months ago, and I ended up at Llandough Hospital for a month, and my children obviously they really missed me, and they kept coming to visit me every day, and the first few days they came to visit me in the ward, and that was quite an imposing sort of environment for them to come into. So we kept meeting down in the gallery, which was really nice, and as the exhibitions were changing the children, we had something to talk about, and it would give me a focus so I didn't get so emotional seeing them as well. Then it sort of really made me understand why that gallery is important in a different way.
It's been great, and I've really enjoyed the collaboration.
I have had talked to other galleries if I consider doing shows there. But what I'm really pleased about is that I'm coming back here.
In the future, you know, I'd really like to continue working with the Health Board, and it's actually given me a focus for my creativity as well.
I had such a successful first one, is, you know, should I risk doing another one? And I wouldn't risk doing another one anywhere but here.